Hi, this is Lisa Solis DeLong back on the Dr. Proctor Show, filling in for T-Cats here on KHTS 1220 AM, hometownstation.com. I don't know why I'm having trouble saying that. But I'm here with Carly Broyles, registered nurse, many, many years at Henry Mayo Newhall Memorial Hospital. And just to bring us up to speed, Carly and I actually crossed paths many years ago, back in 1990, when she was a volunteer on the women's unit here at Henry Mayo, and I was a maternity nurse. I was working mother-baby at the time, and the way Carly was introduced to me is kind of exciting because I posted a request on Facebook, and several people were encouraging Carly to step forward, and I saw the little notes to her saying, "Carly, you should do this." And so I gave her a call. We started talking, and that's when we discovered that she actually was a volunteer. We had already crossed paths many years ago. So that's when I know that this kind of conversation is really meant to be and divinely supported. And whenever synchronicity like that happens in my life, I really pay attention. And so it was kind of like the hand raising from God's vast universe in my mind of saying, "Oh, pick me, pick Carly for this conversation." So anyway, we ended the first segment with an interesting, really revelation that, when we think of mother-baby nursing, and in your case being a labor and delivery nurse, and the joy that you have in bringing in babies into the world, and how even though most of our work in that environment is about bringing in life, there is an aspect of loss and death along with the beauty of birth. And I think it would be helpful for our listeners to understand what that's really like in the day-to-day work. How do you balance dealing with loss on your unit because I remember this from working there as well, is that when a baby does not survive life right in the very beginning, it is an added emotion, very unlike being at the bedside of a dying elderly person, although both evoke intense emotion. And I'm always curious about how medical professionals stay healthy in mind about loss like that, and where that inner strength comes from. So what has your experience been when you show up and you are that courageous person, that courageous healer that walks into a room where there's deep sorrow in that very pivotal moment?
It has definitely been a process for me. Honestly, I dreaded taking care of patients like that early in my career. I avoided it. I always wanted to not, we were like, not it, 1, 2, 3, not it.
Yeah.
Because normally my area is always so happy and fun. And so I avoided it because I didn't know how to act, what to say, what would I do. I'm sure there's nothing I can say. And I know that for me personally, my faith is what sees me through. My love for God. I'm a Christ follower, a Christian, and I know that prayer and the strength that God gives me to do what I do has been a big part of that process. But it's kind of a funny story how I got to the place where I love taking care of those patients, because my husband and I waited several years because we got married so young out of college to have children. And my very first pregnancy ended in miscarriage. And I didn't tell anyone. I went to work delivering babies every day, trying to process this grief. And it just made me even more so not want to take care of these patients because I was broken. And eventually, I got pulled into bereavement training with some of my coworkers, and a good friend of mine was going to coordinate at the former hospital that I worked at this bereavement program, this perinatal bereavement program, to do better for our families experiencing loss. And so I agreed to be a part of it because I wanted to understand it and get some tools in my belt to know what to say and how to help people. So that was all fine and good. I felt a lot more confident coming out of that training. It was through RTS, Resolve Through Sharing, out of Gunderson Lutheran. They put on a great program. So I did that. I did the coordinator training as well. And then this friend of mine mine went out on a medical leave, and the ball fell in my lap to run this program. So here I was, the girl who didn't want to take care of patients in this place became the one in charge of it, and how much God brought healing to me through that, and being able to sit with these patients. Now I just love it. And I find that a lot of times I'm encouraging parents to experience the emotions, to hold their babies, to take pictures, to create memories, because everybody wants to protect from pain. You know, put her to sleep so she doesn't have to experience it. Knock her out. You know, don't look at the baby. Don't hold the baby. It's painful. And what I've learned through training and through my experience is nobody ever regrets holding their baby, but they will regret not. So whether they want to hold their baby or not, we do the footprints, we do the impressions, we take the pictures, we love on them, and we talk to them about it, and we try to walk with them through their grief and wanting to help them build memories so that they have something to look back on and say, oh, these were pictures of, you know, us holding her little feet, or these are, you know, this is a lock of his hair. This is the only pictures that we have left, but we don't want their little lives to be forgotten because they have such purpose and meaning. So just this time last year, I remember, you know, helping a mom through this process, and I never forget those patients. I never forget. And they have such special places in my heart because I know it's part of their story. And there's such a love there, even for a baby born asleep. There's still, you're always going to be that baby's parent. That never goes away.
Definitely. I'm so glad that you brought this up because I think it's important for lay people to really see healthcare professionals as people. You know, one of the things I've experienced in speaking nationally is that very often, because my inspirational story is centered around the loss of my oldest son, Justin, when he was 15 because of leukemia, and then potentially having to nearly losing Jacob, our youngest, when he was on treatment as well for leukemia. And he miraculously, really, truly, the word miracle is appropriate for his survival. He's alive and well today. He's 16, and we're very grateful for that. And because when we as professionals, when we share any aspect of our own losses, it really makes us more powerful as healers to our patients and to those around us. And yet, as healthcare professionals, we rarely ever get to share that side of ourselves. And of course, that's appropriate. I know that in the work environment, you can't, you know, go walk into a room and say, oh, this happened to me and it's all about me and I had this experience too and I'm here for you. You know, you want to step aside and let your patient be there for your patient's experience. And so, but also, I think as professionals, we've been taught to just shut down our own emotions. And again, we have to do that to do our job at certain times, but it's been my experience on both sides of the curtain that when I have had nurses or physicians tear up, shed tears with me, cry tears of joy as well as tears of sorrow, it has been a unifying experience. It has diffused fear. It has made me see my healthcare providers as real and doing the best they can. And I think it's helpful for us to understand and for our listeners to understand that healthcare professionals are people too. We come to work every day with our own, you know, bag of stuff. We got our own baggage on our back as well. And it's not an easy environment. And again, those of us called to the healing arts really have had to do some level of work composing ourselves for the position that we're stepping into. And I remember specifically myself, as when I worked Mother Baby, I chose Mother Baby because it was the safe place to work. And I'm very honest about that. I did not want to work. Early on, I thought I want to be an ER nurse. I want to, you know, be in the helicopter that goes and retrieves people, and I wanted to work in NICU, the neonatal intensive care unit, because I wanted that critical rush, I think. But once I started a family, I was like, oh no, I just want the sweetest place I can go, take care of my patients, and trust my skill level. It was more about that than anything. I thought I can manage taking care of women who've just had babies. So postpartum, perfect. It becomes very routine for the most part, and normal newborn that I can handle. And the irony, it's so much like what you're saying, like what you were sharing prior, was about your own experience of having a miscarriage. And then after that saying, I don't want to talk to anyone about how hard this was or how sad this was. I just, no, I don't ever want to be the one leading the show. Sorry, got a little distracted there. I don't ever want to be the one leading a grief group, infant loss group. I remember working and we at Henry Mayo, and we had a certain language we used for when a baby had died at birth, and all these different things that we integrate into our work practice. But I love how you shared that. That's also in time, over time. You needed to feel what you needed to feel in that process. But over time, it's like just that, again, that divine aspect of life just sort of pushed you into it. Mm-hmm. And then you had to say, yes, I'll step into that, or no. And you said yes. And here you are being of service to other women who've experienced loss. This is Lisa Solis DeLong with Carly Broyles on the Dr. Proctor Show here on KHTS 1220. AM, your hometown station.com. And it's interesting how your life led you to that awareness that you could be of service in both areas, both as the one bringing in life, and also being the one really courageous enough to say, I will go through this process with you. I will step into this arena. So could you tell us a little bit more about the bereavement training that you had? It was
Gunderson Lutheran Memorial puts on national and international trainings for health care providers. It's called RTS, Resolve Through Sharing. They have a training program, and they also have a coordinator training program. And they also offer a lot of products for hospitals to use as far as bereavement care goes, mm-hmm. brochures and just help. Mm-hmm. So this training was like 3 days long, and they helped us know what to say, how to take care of ourselves through the process, mm-hmm. how to know that spiritual care and the chaplain and social services aren't just for the patient, they're also for us as caregivers. They helped us know what not to say, and they help us prepare the grandparents, the siblings, the whole family, so that we're not just caring for the mother going through this, but we're also concerned about all the people that this experience impacts. So it just really empowered us as nurses to go in there knowing how to care for them and how to know what to say and how to guide them. And we used to do things like ask patients, if you want to speak with a chaplain or if you want this. And now I know better. I know that they just need all the love that they can get from anywhere, because mm-hmm. they're in that stage of mm-hmm. shock and disbelief, and that's normal. They don't know what they want or what they need. So we need to know, so that when that mom is reeling from the shock of finding out her baby has passed away inside of her womb, I'm already whispering in her ear, I know that you're searching and you're thinking this is your fault somehow. You're feeling that guilt, mm-hmm. but I want you to push that away because it is not your fault. Mm-hmm. And they tear up every time, like, how did you know? I was thinking that because mm-hmm. I've been taught that. Mm-hmm. I know that every single mother goes through that process of, should I have done this? Should I have done that? Mm-hmm. What could I have done? And I know that if I tell him that, if I'm whispering those truths into her life, that she will know, okay, this girl has done this a few times and knows exactly what I need to hear.
Okay, can I just say amen, sister? You are just so, I have to clap on that, because
thanks.
I just feel like we entered into this beautiful vortex of this is what healthcare is about. having medical professionals who can whisper truths into your ear in a time of crisis. Mm-hmm. I love, love, love the way you just said that, because really that's where healing begins. And when we and I hope that our listeners really pick up on this. Like when you walk into, whether it's a clinic, a hospital, you know, our anxiety is so high mm-hmm. when we're entering into these crises, so high. Like I remember days went by when Justin relapsed and he was, you know, facing the hardest chemo that he'd ever had as a teenager. And in my memory, it's like, it's a blank. So much of it is just a blank. And that's what happens when you're in that crisis. And so to know that there's a medical professional like you who has had the training to say, I know what to say here. Mm-hmm. I know how to approach this person, not only through intellectual training and, you know, written training and formal training, but also out of the experience of your work combined with your experience, your life experience. It's like the perfect marriage between, you know, all that is best about you and our profession. When you have that come together, so I get very excited about that because I have experienced that myself, where you feel like, you know, when you entered nursing, you go in thinking it's one thing, right, and then your life leads you on to many other aspects of being a nurse, mm-hmm. and or any healthcare professional really, because once you take on that label of RN or MD or RT or PT, you know, you really do carry that with you into the rest of your life, unless you like move to an island somewhere where there's no no identifiers. But I love how you just said that. I'm going to keep that image in my mind, and I hope that our listeners will too. That if you are in a situation where you find yourself in an ER or an OR or something, you know, a more critical, or maybe you're getting an oncology, a cancer diagnosis for the first time, that to know that there are people around you who are trained to whisper truths into your ear, and for the medical professionals who are listening to embody that same mindset of I'm gonna hold on to, I'm gonna try to educate myself as much as possible, take trainings that maybe make me a little uncomfortable, mm-hmm. right? Like yes. That was uncomfortable training yes. to do bereavement work, and I'm a bereavement facilitator myself, and really appreciate having the training that I have as well, because it's helpful for your whole life. But tell us a little bit, and we only have a couple minutes left, but tell us about what you do now. You were mentioning about the work that you do as a volunteer at your church. Tell me about that, so our listeners will know that this is available to them as well.
Well, the classes that I teach are actually through the hospital. Oh, okay. I teach childbirth classes, which there's a 7-week series that we offer, and also like a 1-day boot camp version. But I teach...
Ooh, birthing boot camp.
Yes. I teach, you know, all kinds of childbirth, everything from, you know, preparing for birth to taking care of a newborn. And part of that series is transition to parenthood for new parents. And as of just the past few months, my husband and I are now teaching that particular course at the hospital together. Oh. And so we cover topics such as...
And why your husband?
Oh, well, my husband is a licensed marriage and family therapist, and he's also a pastor of marriage and care at a church out here.
Uh-huh. And what church is that?
Grace Baptist Church.
Oh, nice. Okay.
Yay, GBC. So it's really fun for us to get to do this together, because he brings in the therapy side. He really does a lot of work for marriage, and having a baby does a number on your relationship. It really does. So being prepared for how to maintain your relationship through becoming parents, as well as how to prepare yourself and take care of yourself and your identity becoming a parent. Everything is changing. People are constantly giving you crazy little pieces of advice like, well, you'll never sleep again, your whole life's over, and that's not true. Yeah. So we combat that, and then also how to tackle more than just what I cover in the newborn class, the baby care. It's how do we handle attachment? How do we handle sleep and feeding? How do we connect with our newborns? It's a fun class.
So listeners, do you see how fortunate you are to have Carly Broyles and her husband in our lovely Santa Clarita community? I mean, a wealth of knowledge, a wealth of support. So Carly, how can people find you and the work that you're doing, the classes? How can they find you?
The classes that we teach, you can find on Henry Mayo's website. If you go to henrymayo.com, you can find the classes under our courses. Mm-hmm. And my husband, as well as at Grace Baptist Church, he does a lot of counseling. He also runs a spiritual care program that provides lay counseling to anybody in need, mm-hmm. which is a really neat thing. Mm-hmm. And so, yeah.
Wonderful. So as we wrap up today, we can really take a look at how the healthcare professionals in our community are supporting us through, not only through the exciting and lovely upbeat times of childbirth, but also through the very tender and delicate moments of loss. And I just think, if you're listening to this program, then you obviously have a curiosity about healthcare, whether this is for you personally or for people that you know. When I look at Carly as sitting here in the station with me, I think, this teenage girl who was a volunteer at the hospital, whose grandpa taught her the sensitivity about what it was to be healthy and then to pass, and then all of that to come full circle to her now serving the community in such a wise and tender way. So that is healthcare at its best, and I'm just really honored to have had this conversation. And as we prepare to take a break, this is Lisa Solis DeLong with Carly Broyles on Dr. Proctor, KHTS 1220, hometownstation.com. Hello and welcome back. This is Lisa Solis DeLong on Dr. Proctor here on KHTS AM 1220, hometownstation.com, with my guest, Carly Broyles, RN and labor and delivery nurse here at our local, beautiful, lovely Henry Mayo New Hall Memorial Hospital. And we've had a lovely conversation around what it has been like to become a nurse and to share your wisdom with the community and your patients. And so the only question I have left in this last couple of minutes we have is, how have you adjusted? How's your family life with working as a nurse? Shift work can be tricky, holidays, all of that kind of thing. How has that been for you?
I love the flexibility of my field. When I started out, I worked full-time. Prior to having children, the first 7 years of my career, I worked a lot. And then when I had my first son, I took 6 or 7 months off, and then I came back per diem, which is 1 shift a week. And I did that through several years of when my children were little. So I was able to be home with them and had family surrounding me. My mom was great about helping care for them on that one day that I would work. I work days, 12-hour shifts. They're long days. Mm-hmm. And
just for our listeners, a 12-hour shift starts at 7 mm-hmm. and ends at 7. So just think about that. You get there, the sun is just coming up, and when you leave, it's dark. Yes. So a 12-hour shift it's a long haul.
It's a long day.
Yeah.
And now I work part-time, which is a minimum of 2 12-hour shifts a week now that my kids are a little bit older. So I have to have family support to help me on those days, and I definitely have it. I love that my family is here. Both my husband and I have parents that live in town. So that's a big blessing for me, and friends that help me carpool.
And you have 2 sons. They are 11 and 8.
Yes.
And how do they ever play with your stethoscope at home and want to hear heartbeats, and because as nurses, we tend to teach our families just because our stuff is there, and we're like, here, let me show you this anatomy book and that kind of thing. Do they come to you?
Yes, they do. And they think it's fun that I go to their career day and I teach, their friends about, what our organs do, and amazing things about how we grow an organ when we need to have a baby, the placenta, and how cool it is, things like that. They think it's good that I know what to do when, you know, my son with asthma or peanut allergies, I know what to do. So they're not worried about if they get sick that, oh, mom's a nurse, she knows how to take care of me.
Right. It's so interesting. I've had the same experience with my family that, you know, my kids come to me with those kinds of questions, or they run from me because I'm like, here, let me tell you about how all this works. And they're like, you know, hiding their heads under the pillows. Like, please don't tell me.
Yes.
But, well, this has been an awesome time with you. And I'm so grateful that you said yes, and that those of our listeners can feel hopefully an expanded awareness about what medical professionals do and what we really have to offer as human beings, and that they can feel safe when they walk into the doors. There will always be somebody there who is willing to try to help them as best they can, and that is the natural calling of a healer. So I am Lisa Solis-DeLong, registered nurse and author of Blood Brothers, a memoir of faith and loss while raising 2 sons with cancer. My book is available on Amazon. It is now required reading at our College of the Canyons nursing department, which I'm very proud of.
Great.
Yeah, and I am also available on lisasolisdelong.com and on Facebook by the same name. You can friend me there. How about you, Carly? You want any new friends on Facebook?
Sure. I'm just under Carly Broyles if you want to look me up.
There you go. So it's been an awesome time together, and I'm really grateful. And like I said, I'm very, very grateful that you said yes, and that here you were the volunteer when I was working on the women's unit, and now here you are running the show over there, and here we are saying see you next week on the Dr. Proctor show, or in a couple of weeks. And it's every first and third Thursday of every month. And T-Cats and I will be co-hosting and sharing for a bit. And I'm very grateful for our listeners. Thank you so much. We'll see you next time. This is Lisa on KHTS 1220 AM, hometownstation.com.